Doc, Bo here, your third son. First of all, I would like to say, because I know all the guys have forgotten to say this, I want to commend all of the good-looking women in the audience tonight. Now, getting to Dr. Andrews. First of all, Doc, I would like to say congratulations on this prestigious award that you're receiving this evening. I wish I could be there, but I'm in Plantation, Georgia at the Chick-fil-A College Coaches Golf Tournament with Coach Malzahn. On behalf of athletes, Doc, both amateur and professional throughout the world, we would like to express our gratitude for all that you've done for us to help keep us on the playing field. I've been very fortunate to have had you in my life since my college days. And all of the decisions you've made toward me, not only as an athlete, but as a third son, has helped me out tremendously. The world of sports and sports medicine have been truly blessed by having you being a part of everything that's going on in the sports world as far as talent. Your contributions to the sports medicine world is astronomical. I could say this: if you could have 1/4 for every athlete, every surgery, and most of all, every piece of advice that you've given athletes such as myself, you could get Bill Gates to mow your lawn for you. That's just how important you are to the world of sports medicine. I hope you all enjoy a great evening. Doc, I hope you have a wonderful evening. Hope you all the best. Enjoy the evening. God bless. And hi Janelle. She is a real boss. Love you guys. You all have a nice evening. Bye-bye.
When the best of our sports superstars in all the major sports suffer serious joint injuries these days, the vast majority of them invariably turn to one man. That man is Dr. James Andrews.
Life's always a challenge, and I enjoy a challenge, and it seems to become more challenging as I get older. Taking care of the kids that play football in our state has been my passion for 40 years now.
You know, Dr. Andrews is a name I heard growing up. He actually moved to Birmingham when I was a senior in high school in 1986. I knew a lot about him as I went through medical school and residency, and it was kind of a dream to be able to work with him someday. He's been, kind of my mentor and I guess my father in the profession. I feel like he's taught me, the majority of what I know in orthopedics and a lot about how to treat patients and how to communicate with patients and what really leads to a good outcome, not necessarily just in surgery, but the overall care of the patient.
He's been a mentor to us. I often say I feel like one of his kids, and he treats us like his kids, and when we need to be treated like kids, we get treated like kids, but we have an enormous amount of respect for him. I personally think he's just a giant of a guy. He's a pleasure to be around, and I consider him a friend as much as a partner. He's somebody that I feel like I can call anytime with questions. He always has time for me, and as busy as he is, I think he's a very fatherly type of person in my life, and I couldn't be happier for him where he is and what he's doing, and I've enjoyed this. I'm honored to have been a part of it.
I've never been able to understand 100% where I am or how I got here, to be honest with you.
He developed this keen interest in teaching and research. And from that, obviously over the years developed the idea that he would have his own research and education foundation, which he founded here in 1986 when he came to Birmingham, the American Sports Medicine Institute. Through the years, he's trained close to 400 sports medicine orthopedic physicians and has gone on to do some great things in research, which we're very proud of at the American Sports Medicine Institute. In addition to Dr. Andrews being a father figure to so many of the orthopedic surgeons who have trained with him, he's also been a father figure to countless number of athletes that he's treated.
When I hear Dr. Andrews' name, there's a smile that goes on when I know how much I was able to pitch after my surgeries.
There's no question the reason I had the career that I had was by having that one-on-one meeting with Dr. James Andrews, no question.
You know, I was fortunate early on in my career to have some signature athletes that sort of jump-started my career.
Obviously, when you're going about doing what you do, you don't think about injury. But if you have injury, my mind immediately, I just go right like it's like a registry. I go, where's Jim? What do you think Jim would say? What do you think Jim will do? I need to call him.
Is there really something about a guy like Dr. Andrews that makes him better than everybody else? And the answer was, yeah, there is.
You know, Dr. Andrews talks about how he really first had the idea of getting into sports medicine, and that idea came from his grandfather, who would sit him on his knee and talk to him about he was going to be his doctor.
On the way to that goal, he headed to LSU, where he was Southeastern Conference indoor and outdoor pole vault champion before completing medical school at the LSU School of Medicine, which led to an orthopedic residency at Tulane Medical School. His studies took him to surgical fellowships at the University of Virginia and the University of Lyon, France. Although the famed Tommy John surgery was first performed by Dr. Frank Jobe, Dr. Andrews is recognized worldwide as the leading expert in the procedure.
So how much is this elbow worth?
Probably not as much as it used to be.
What I learned about the Tommy John's procedure was directly from what Dr. Jobe had pioneered. So I have a lot of credit given to him for what I do and what I've learned about baseball injuries.
How is it you can be the doctor for Auburn and Alabama?
I guess I can't answer that question.
He's got that magic touch though, you know what I mean? You break something, he don't really have to do surgery, he just kind of put his hand over you a little bit and heal up.
He's just got that healing power, that's it?
You know what I mean?
He should be on Star Trek.
He's a Jedi Knight.
He's been my doctor ever since I was 17 years old when I first went to Auburn.
When you call him, it's like, hey, this is the first case he's ever taken care of, or it's the most special case he's going to take care of. It makes you feel that way. That's great. That's why you have so much confidence in him, because he knows he cares.
Everybody who even thinks about asking me about my shoulder, before they can even get the words out of their mouth, I say, Dr. Andrews.
You get hurt, the team doctor wants to operate ASAP. I'm like, not until I send my MRI, my x-rays to Alabama.
And in 1999, he began to notice an alarming epidemic of young baseball players coming in with very significant shoulder and elbow injuries.
I've devoted these few last years of the twilight of my career to prevention in youth sports.
I'm like, hey man, you had a wonderful life, a great career. It's time to slow down.
I'm working because that's what I like to do. You know, we have a lot of sayings. One of them is if you don't enjoy what you're doing and it's not fun, go do something different. I get up every morning thanking the good Lord that I'm able to go do what I do on a daily basis.